In this video, we will discuss appropriate versus inappropriate self-disclosure. Self-disclosure, as defined in our textbook, is the process of deliberately revealing information about oneself that is significant and would not normally be known by others. It is important to note that it is only counted as self-disclosure if it is information the other party does not know yet. It is deliberate and it is significant. Self-disclosure can be used to strengthen relationships and also blossoming support to both parties by providing catharsis, self-validation, and reciprocity. Self-disclosure is measured by breadth and depth, in which breadth is the amount of information shared and depth is the privacy of the information. In casual relationships, there is usually a lot of breadth but not much depth. In intimate relationships, there is depth in at least one, if not many, categories. In this skit, you will see a patient and therapist interacting at a therapy session. You will see how it is important to think about how you say something before deciding to self-disclose. In both situations, the therapist is wanting to help, but there is an appropriate and inappropriate way to help her client.
So what's been going on with you lately?
I've just been really anxious. I'm finding mundane tasks like just driving and cooking and spending time with my friends really hard to do.
You know, I've dealt with that in some of my other patients, and I've even dealt with it myself, and it can be really hard when everyday normal tasks like that seem easy to them, and it just feels like you're hiking a mountain to us, and I just want you to know that you're not alone.
As you can see, this is an appropriate example of self-disclosure. The therapist stays focused on the client's experience, keeps their self-disclosure relatable and brief, and it normalizes the client's feelings. It's not too much information, and it still creates trust while maintaining professionalism. Now, let's look at a moment of inappropriate self-disclosure.
So what's been going on with you lately?
I've just been really anxious. I find basic tasks like just driving, cooking, and spending time with my friends really hard to do.
You know, I relate to that so much, because there was this one time I actually broke up with my boyfriend the first time, and it was so awful. Like, I couldn't stop drinking. I started doing drugs. I couldn't get out of bed. It took me months to recover. So you're not the only one.
This is an example of inappropriate self-disclosure because in the client's vulnerable moment, the therapist made the situation about herself. She starts to burden her client and makes her client think she needs to comfort her. And it also confuses professional boundaries, which are crucial between client and therapist relationships. As you can see, when used correctly, self-disclosure can be a wonderful tool to strengthen relationships and deepen bonds. It is important to think before you self-disclose. Ask yourself, how does this benefit the situation? What is the purpose of this disclosure? Is what I am about to say appropriate? Thank you so much for learning about self-disclosure with me, and have a great day.